Welcome back to Community Conversations. I'm your host, Steve Mantis, and my guest today is Iggy Kosny, a scientist at the Institute for Work and Health in Toronto. Welcome back, Iggy.
Thank you.
So you're talking about kind of there you were on your master's and then moved into the study of work and health. We met about 10 years ago when I was working on a project on the consequences of work injury, and you became our first postdoctorate fellow in
Yeah.
2007 or
Yeah,
'08,
yeah.
somewhere around in there. So where did your research go during that time period?
So during that time period is actually when I started doing a project with injured immigrant workers. So this was a study where we interviewed recent immigrants who had been injured, and some of them had reported the injury to workers' compensation, some of them had not. And we wanted to know about their experiences both around what happened after their injury, what happened if they had reported the injury to their employer, to the workers' compensation board, to their healthcare providers. So just to get a sense of their experiences, because of course, workers whose first language is not English have some particular challenges when it comes to what happens after they're injured. And so we wanted to kind of explore what those were in the hopes that we could potentially improve things for those workers.
And so what did you find? What kind of experiences did workers have?
So I think just what I was saying before is, one of the things that really surprised me with that study was that many of the workers, in fact, most of the workers we interviewed did tell their employer, did tell their doctor that they had been injured or that they'd been hurt at work. And so some of those employers, of course, reported that injury, or their healthcare provider reported that injury to the board. But some didn't, or some decided not to for a period of time. So there was this sort of delay. So one of the things that we found was, I think that there is this impression that immigrant workers they just don't speak up, and like part of the issue is that they just don't speak up because they don't want to lose their jobs. And I certainly think that is a reality for some workers. But it was interesting to me because these workers, many of them did tell their employer, and they did tell their healthcare provider what had happened. And so the other, I guess, stakeholders in the system who were meant to then follow through and submit a claim and get these workers help. Some of them didn't do that. Some of them decided to say, oh, well, why don't we just give you some sick leave? And so, one of the things we found was that these workers were sometimes vulnerable to that kind of exploitation where they didn't know very much about the workers' compensation system, didn't know very much about their rights. And so in a way, it was easy for certain employers to kind of sweep the injury under the table. And of course, we know that there are many great employers who wouldn't do that, but that was the case with some of the workers that we interviewed. We also found things like in terms of language difficulty. So of course, the Workers' Compensation Board has a translation service, but often workers knew some English. So they tried to, it's awkward working with an interpreter, and so they tried to speak to their doctor, to their case manager in English. But what we found is that as their claim became complicated, and some of them were straightforward, but some of them weren't, this resulted in problems because there were things at the start of their claim that were missed, that were misunderstood because they weren't using an interpreter. And so that offer of an interpreter, just once at the start of a claim is really not sufficient. So that was one of the other findings we had, is that we really suggested that, it's something that needs to be done throughout the claim. I guess the one thing that also came out of the study was that I found really interesting is many of the workers we interviewed had accessed settlement services and specifically job search programs and like work readiness programs, yet virtually none of them had any information about workers' compensation. So what do you do if you get injured? Like, there is a workers' compensation board. These are your rights. Very little information about health, occupational health and safety and employment standards. And so one of the positive things I think that came out of the study was we developed this toolkit specifically for settlement services that could be adapted and used as part of employment preparation programming, so that when you're talking to recent immigrants about employment preparation, that should always include something about their rights, about health and safety, about what to do if they're injured.
So, in my limited experience working with academic researchers, you've kind of taken a unique path where not only do you identify a problem, but then worked with community folks to try to address that problem in a positive way.
I mean, I don't know. I wouldn't say that's unique. Like, I feel like there are many academics who certainly try to do that. I think it's sometimes difficult. I mean, I have the luxury of working in an organization where I do research, so I don't have to teach. I'm affiliated with the University of Toronto, so I have to do some committee work with them. But so that does free up time a little bit to go a little further with things like, engaging the community and doing things collaboratively after a research project or during a research project. And certainly working with like RACWI, so the Research Action Alliance on the Consequences of Work Injury. It's a mouthful.
Snappy little name.
Yeah. So that was such a great opportunity because it brought together academics and community-based researchers and injured workers, and I think really started a dialogue that, even though that project is now finished, has continued and has this legacy of bringing those groups together and connecting them across various projects. So I think that was a really nice outcome of that initiative.
Well, I have to share my own kind of personal take. Is I just think you as a researcher is exceptional for your commitment to that process of working with the community, and I'm just so happy that you're here to share some of that experience.
Oh, thank you.
So you identified in your study that sometimes the injured worker would go to the doctor, say, I got hurt at work, and the doctor didn't ever report it. And so now you've just done another study on how the interaction with those healthcare providers works with the compensation board. Tell me a little bit about that.
Yeah, so we did the study in 4 different provinces, including Ontario, so BC, Ontario, Manitoba, Newfoundland, and Labrador, about healthcare providers' experiences with the board, and specifically around helping people who are injured return to work. And I think one of the things that we found was when we spoke to healthcare providers, their experiences with straightforward injuries, visible injuries that were very clear, and there's objective evidence that this person had this kind of injury, that this happened to them at work, were relatively straightforward. So the forms that they used were fine for those types of injuries, their knowledge of the system. But where things kind of went off the rails a little bit.
And we're going to hang on right there. We're going to take another quick break. We'll be right back. Please stay with us.